reason why I love these patches is because not only do they work, but I'm able to help thousands of people rather than one-on-one in my office, right? So I get to expand how many people I get to help, and that's rewarding to me. And I've had great results personally. The first year all I used was the X39, and I'm a practitioner that I have to use the product and know that it works before I share it. And so the first few days I had more energy. Day 5, my hip pain went away, has not come back. After 7 months, my hair stopped falling out, which was a big deal. And then I had a numb toe left over from bunion surgery. That came back, no more numbness. And so I started sharing it with my patients and just have had great results across the board with many different health issues. And I just think it's one of the easiest products for people to use. And what's nice is these patches don't just work on one thing. They work on so many things, whatever that person needs. And that's the beauty of light therapy and energy, which we are energy and light beings. And I think the most important thing is to just make sure that people wear it for at least 90 days, because even though someone doesn't feel something right away, it doesn't mean it's not working. Many people, the biggest challenge with my clients is that, they want to work overnight. They want to cure, right? And we don't cure or prevent any disease with these patches. But if they wear them consistently, keep hydrated, and let the body do what it needs to do to balance and regain that homeostasis, bring that inflammation down, build those peptides and stem cells, then they go to work and start working. And I like to make sure that people do at least 90 days to really get that working and get that balance, to get the cells communicating again. So yeah, I just love these patches.
So, doctor, you yourself had testimonial from your hair not falling out anymore, your toe, your numb toe going away, your I believe you said your hip pain gone, and I think you said one other thing. But what I think is so interesting is that's all over the place, not losing your hair versus a numb toe getting better. Like, why all over the board in your own body? And what, did it happen all at once, or was it kind of a journey of the stem cells? Like, that seems like a lot of different things happening because of one patch. Can you explain that a little more?
Right. So as the peptides are building, the stem cells are building, and the inflammation in the body and the hyperactivity in the brain needs to come down before they can really start communicating with our organs and systems and the cells. So it takes time, and the stem cells are designed to repair any organ and tissue in the body, and they can turn into any cell that we need to heal internally. So I think because it goes to work at what's most important, and they fix that, and then they go on to the next thing. And that's what happened with me. I mean, my hip pain, fortunately, I'd only had a hip issue for about 5 months. So it was a newly thing that was starting to happen in my body. And that was something that the stem cells went to work right away. They knew they could fix it quick and then move on to the other things. My hair falling out, my hair was falling out for 2 years, and I was going bald on the top. And so it took a little longer to work on that. It was 7 months before I noticed when I brushed my hair, there was no hair in the brush. So everybody's different, what the body feels it needs to repair first.
And now you've been on this technology for over 3 years?
Yes, and 3 years, and I don't have any aches and pains. I feel 20 years younger. My skin is amazing. I mean, compared to what it was, my hair's fuller. I feel great.